All right, recording. As always, good to have all of you guys on. Ladies, again, I'm glad to have a little more testosterone in the room, Zoom room tonight with Dr. Dodge, because you ladies have been representing lately. I love it. Love it, love it, love it. We need to get our men in here too. Um, so I'm not gonna waste a whole lot of time tonight, guys, just because I want to give Dr. Jamie and I don't know if his wife Melissa is going to jump on at all, but she's going to help share screens. I want to give them as much time as they need tonight. I think, I've talked about this the last couple of weeks and kind of told you guys, giving you a couple little teasers, right, about what he's going to talk about tonight. So I'm excited about it. Just the innovation of what he's doing, not only in his office here at Aletheia Integrative Medicine, but also with what the topic is tonight, which is some cool stuff with new technology with stem cell. And I'm going to let him explain it because I'm still learning about this stuff, which is just super, super cool. And I don't know who the iPad is that just joined us, but welcome, iPad. Glad to have you here and glad to have everybody who's going to watch this later on. A lot of people watch the recordings, as we all know. So, it's Michelle. Hi, Michelle. It's good to see you. Okay, so I'm gonna even pass by the wins tonight unless someone has a really great win. Does anybody have like just something they've just been waiting all week to share with the group? Because if not, I got a haircut. Did anybody notice?
That's a
That was a
huge
huge win.
win.
Huge win. Huge win. So anyway, I like it. It's good to have that mop off my head. So anyway, Dr. Jamie Dodge, you guys, a couple of you guys, I don't know how many months ago it was, Doc, where I had you on as a guest, talking about kind of your integrative practice here. So for those of you who are in Lincoln, Nebraska, which the majority of you on the live call are in Lincoln or around Lincoln. Primary care medicine. And again, Dr. Dodge, if you want to talk about the practice at all, feel free. But I'm just excited. You guys know this now. I'm actually sitting in his office and he's at home because now my office is within his office, which is just super cool. I'm excited about it. I'm really excited about it. So for all of you guys that are in Lincoln, we can do in-person functional medicine appointments. Doing a little bit of chiropractic work out of here too. If you have any interest in that, just get a hold of me. So the in-person meetings have been great so far this week. So if you have interest in doing that, let me know. And then also, if primary care medicine and all the things that they're doing here with hyperbaric oxygen therapy, red light therapy, IV, just a place to check out. I know Dr. Dodge and Melissa, they are so willing to sit down with you guys if you have questions and answer those for you and see if it's a good fit for you. But I'd encourage all of you guys, your friends, your neighbors, your co-workers, whoever, to come check this place out because it's just very innovative as far as the primary care world goes. Okay, so please do that. And he didn't pay me to say that either. So, there we go. I just believe in it, right? So, Stephanie, all right, Stephanie, all the way from Florida on. Good to see you, Stephanie. Stephanie, hi. Okay, Dr. Dodge, take it away. With no further ado, Dr. Jamie Dodge.
Dr. Scott, thanks so much. Great to see everybody. Yeah, boy, time flies. Really appreciated the last invite you gave me, and it's awesome to join the group again. And as everybody, Dr. Scott just said, we are super excited to have him sharing the space in the office, believe 100% in the work that he's doing with his functional medicine practice, and just recognize just how foundational that is to your health. And really impressed and glad for the work that you're doing, Dr. Scott, and for everybody that's working with him. You found a great one. And so we're just, again, super excited to share what the new technology then brings to then complements and accelerates all the work that he's helped you through and continuing to work through with you. So wanted to talk a bit tonight about stem cell technology. So a lot of people may have heard of that, but just in brief, stem cells are the cells in your body that we're all born with. So what we're doing with stem cells is looking at how can we activate and mobilize them, because they don't really go away. I mean, what happens is they go dormant. So stem cells can turn into any cell in your body. You're born with lots of them, and then around age 30 or so, they start to kind of go to sleep. And so when your body needs repair, it goes to its stock of stem cells. So, but what happens if they're not ready to be used? Then, well, repairs and healing and feeling good get delayed. So at age 30, I mean, almost half of them are inactive. And then every decade on down, you have a percentage higher that becomes less and less active. So by 60, I mean, almost only 10% of your stem cells are even active. So the cool thing is, as technology advances and people recognize how important this is, there has been a company um, started by Dr. David Schmidt called LifeWave, who has harnessed technology that is actually wearable and quite inexpensive, that mobilizes and activates those stem cells. So Dr. Schmidt, it's a great time to just read about him and all the work that he has done and is doing. Um, very, very fascinating man, very smart guy, and always innovating. So what he discovered is that we're using phototherapy. So, and just in brief, phototherapy is using light waves to affect a change in your body. And a lot of people are familiar with this concept, and the common one is, okay, so if I go outside, I get vitamin D, right? Well, you get full spectrum sunlight, which includes ultraviolet light, which then actually penetrates the skin layers and turns cholesterol, yeah, not all cholesterol is bad, in your body into vitamin D. So that's phototherapy. And it's naturally, obviously, designed, and you're created to receive that light energy, and it benefits your body. So other spectrums of light, including what we call infrared. So infrared makes you warm. And then near infrared, that's kind of what we're going to hone in on here, is infrared or near infrared light at certain wavelengths tells your cells to make what we call peptides. So peptides are simply protein-based molecules that are messengers. So in the case of X39, for example, the light waves make copper peptide, specifically GHK copper peptide, which in and of itself does many, many things throughout the body. It activates mitochondria. It turns on the portions of your genes that are helpful and suppresses those that are more on the harmful side. And all of those then signals cascade into activating those stem cells. And then when that happens, essentially all the good things that come about with having just say fresh cells happens. So energy improves, sleep improves, people heal more quickly, they just feel a new sense of, vigor and youth. And we're seeing a lot of things in our office, testimonial wise, and things we can measure on lab with lab improvements. Patients are talking about, boy, I can sleep through the night now. Wow, this foot that was hurting for years now doesn't hurt any longer. And all of this essentially is so foundationally important, but it builds upon the work that you've done with your own health, when getting your gut healthy, getting rid of chronic infections, toxins in your body. And now with that foundational help, you have now new cells or activated cells to start to repair all those tissues and undo all that damage that's been done. So throughout your body, and we all know this, you have different things. You have skin, you have joints, you have muscle, you have organ tissue. And well, just frankly, just through the process of life, through all the hazards and environmental toxins, through our food, through the, different pesticides, heavy metals, chemicals in the environment, and even the process of aging that shortens what we call the telomeres, the ends of your genes that keep getting smaller and smaller. All of that damage accrued requires repair. Well, what happens if we don't repair it? Well, we don't feel well, our organs don't function as well, and we age more quickly. So the stem cell activation is so important because now that they can self-renew and then turn into different cells that need replenished in your body, now we can make some of that joint tissue. We can make some of that muscle tissue, some of the damaged kidney tissue or gut tissue or liver, and even brain. So now when we do that, we look at all the things that people are noticing. I mean, they're working out, starting to get more active, and they're noticing it doesn't take me as long to recover. They're sleeping much, much better. So then the mental clarity and the brain fog improves, the brain fog lifts. They notice, you know what, things don't take as long to heal. My joints aren't inflamed. This body-wide inflammation that a lot of my patients come in with is just decreasing. And some of them even say, you know what, starting to look younger, not only feel younger, but look younger. So again, all these things that people are noticing just because of this internal renewal that's happening. During the research with X39, and X39 is, just to clarify, that's the specific product that contains, so again, it's wearable technology, no electricity, no chemicals, no drugs. It's simply an adhesive patch that you place on your skin, really anywhere in your body, but there's a few specific areas that we usually target. But you place the patch on your skin, the infrared light emanating from your own body reflects off the crystal, which crystal made out of amino acid and carbohydrate within the patch, then reflects back to the cell, kind of like a radio signal, and then says, okay, make this peptide, activate these stem cells. And throughout, the process of wearing this, you had a patient with a brain scan showing lots of inflammation with the red. So again, memory problems, brain fog, just maybe some anxiety, even noting over time reduced inflammation. And after 6 weeks, really a complete turnaround in how this patient felt and how her scans looked. So again, just a photographic, graphic analysis of what people are then telling me about, hey, this is how I'm feeling. I was, highly inflamed, not sleeping well, mind racing, all that sort of thing. That's just getting better and better over time. Now, we recognize that with any healing journey, it doesn't happen overnight. And a lot of our patients will maybe not feel a lot different in the first few days, even weeks. But we know that internally, based on the studies on the product, even within the first few days, we talked about those genes, they begin to reset. They begin to turn off the harmful portions, turn on the helpful portions of those genes, and start to then make the requisite chemicals and processes in the cells that begin to help heal and reverse some of these ill effects that we've been noticing. So even after about 6 weeks, and we found that's about the turnaround time where patients say, you know what, things really started to unlock. It took about 6 weeks, and now I'm feeling more calm, less anxious. My mind is clear. In 3 months, after 3 months of continuous use, noticing maybe some fine lines getting better, hair is improved, and then your muscles, even your bones. And I've had a patient that just had a bone scan for osteoporosis that has been wearing the X39, came back, and her bone scan was actually improved enough that another doctor she's working with took her off the medication that she was using for osteoporosis. So she's still on her supplements, she's still doing all the healthy things with her gut, but again, one less pharmaceutical was a win in her book. And then even after 6 months, we start to see some effects on the heart. I have a patient in my office who came in with about a 20% ejection fraction, which is actually severe enough heart failure that he was recommended to wear a life vest to kickstart his heart in case it stopped. He chose not to do that. Again, his choice, but we began working together, and now 6 months later, he's actually back to a normal ejection fraction on his heart. So again, this isn't the only thing he's doing, but This was a significant part of his recovery process. And even Dr. Schmidt at the bottom has a great quote there talking about not just anti-aging, but reversing it. So reversing these effects, not just, stopping where you're at. Yeah, that's the first part, but actually trying to, reverse some of the effects of aging on the cells, tissues, organs, and body. So again, on the X39, we wear it. Couple places that are highlighted here, and the reasons are when the research was done on the product, the researchers simply just had to pick 2 sites. These are actually important acupuncture sites, but these are the 2 just for consistency and to be able to demonstrate consistent results. We went 2 to 3 finger widths below the navel, or right at C7, kind of on your lower cervical spine, lower part of your neck, upper back. Now, it's important when wearing these, and we've discovered this in practice over and over again, that you put these on first thing in the morning, because they're actually energy producing to the degree where if you put it on too late at night, it's like having some kind of an energy drink or exercising too late at night or drinking coffee. You'll actually stay up later. So to get your important restful, restorative sleep, it's important that you put these on really first thing in the morning. So whenever you get up, just part of your routine, put your patch on, and about 12 hours later, take it off. Next day, new patch. You can alternate sites. You can keep it at the same site. We have some patients that wear them in a different area just out of preference, or if they're trying to really heal up a hip or a shoulder, or even, lower back, we might have them wear them there from time to time as well. The importance of drinking lots of water. I talked with a patient today about that. Again, think of it as you're healing your body, but sometimes the healing process takes energy. It draws on resources of your body. So things like water and electrolytes and extra rest become really important, especially initially when wearing X39, because you're drawing on those healing resources such that you may not feel like you have as much to do other things. So we do even have patients, especially that are kind of early on in their health journey, they have a lot to unlock, a lot to improve. They might actually feel a little more fatigue in the first several weeks. That's not uncommon, and that's okay. That just means your body has a lot of work to do. It's been a number of decades since 30, perhaps. And so now it's just taking a little bit more time to really kickstart that healing process. In all of these testimonies, just areas where people are noticing improvement. I know the one that I talked a lot about today with some patients was bladder improvement, which then actually helps with sleep, because a lot of people get up, once, twice, maybe more times during the night, both men and women. Boy, that interrupts your sleep cycle. You maybe can get back to sleep, maybe you can't, but if you track your sleep, it's still not ideal. And then during the day too, I mean, who doesn't want better bladder control and function? The mental clarity I mentioned, patients are noticing that very consistently. Joints, boy, I had a family member that actually had arthritic hands such that she couldn't get her ring or rings that she wanted to wear on or off her fingers. And it actually only took her about 2 weeks to where she had noticed, even from photographs taken years ago, maybe 5 years ago, that her hands were smaller, her joints were smaller, and she was able to wear her rings again. I didn't even really know to expect that. When we started her on it, it was just for general health and wellness, and she brought it to my attention and said, you know what, I can get my ring on and off again. Didn't think I'd ever be able to put my wedding ring on. So now she can. So we see consistent improvement with joints. And, for those of you working through, and which is probably almost everybody, we all use help with our gut. I tell you, healing up that inflamed and leaky gut, everything you're doing supplement wise and nutrition wise with Dr. Scott, your X39 phototherapy patch is going to help and mobilize those peptides, activate those genes, and bring those stem cells to the gut to really replenish that and heal those tissues that need healed. We have some testimonial photos of patients, again, with wound healing. You can see, you know, an area that was sutured, and even 2 weeks later, X39 patch. That person, you can wear the patch close to an area that needs healing like that. We've had that with some patients with lower leg ulcers, for example, non-healing wounds. We'll have them wear the X39 very, very close to that wound. Hair regrowth. Again, these are patients that after that one's a little bit longer, you know, to notice. You might see a wound heal relatively quickly, but insofar as hair thickness, a lot of people, I had a patient today telling me about, you know, she had noticed thicker hair. I actually noticed it walking into the room, and her hair loss began with a COVID infection a couple years ago, and she was frustrated, understandably, but she's now been on the patch 3 months, and had already got her hair restyled to the point where it was impressive. It was noticed even by me. And I won't say I'm the world's. I did notice Dr. Scott's haircut, but that was a fun thing to see for that patient who'd been frustrated for a couple of years. So again, skin, collagen, hair. There was a patient that after almost a year really transformed by, you know, even a period of almost, well, you could say years, I suppose. And that's that effect on the collagens from the gene activation and the copper peptide activation. And that could be my last slide.
Yeah, I was gonna say, was that the last slide? It looked like it might have been the last slide.
Yeah, so it's been a
Cool.
really exciting journey with this technology, and Dr. Scott's excited to, you know, be able to implement it in his practice with all of you and other clients. So that's, again, both he and I we're always looking for, you know, how do we heal the body? How do we harness the body's healing resources to heal and treat naturally? We're designed to heal. We're created to heal. We just need to give the body sometimes the proper mix of, say, stimulus or resources to do so, and avoiding, you know, the things that are harmful, and then adding in things that are helpful. And this is one of those, I would say, key new pieces of technology you can harness, you know, to your own, really to serve you in your health journey. So it's awesome, and I'm really glad Dr. Scott's excited to share and allowed me to talk a little bit more about it.
Yeah, so I would love to, if you're open to it, we'll open it up to questions in a few minutes, but can I do like a kind of a little Q&A between you and I?
Oh yeah,
Quick.
let's
So you know, gosh, even some of the pictures you showed were just amazing results. So just, but in your practice here, and I know you already mentioned a few cases, but like, what are like one or two or three of like the most common things that you guys are using this for, and then results that you're seeing?
Right. I would say using it for almost everybody, because almost everybody in my practice has something they're trying to unlock or heal. And you know, especially, boy, you're 30 plus, you're 40 plus, boy, what isn't? So, and I've seen it vary by decade, you know, kind of what's the most pressing thing in that. But I'd say energy, you know, boy, do you feel tired? Yeah, I'm tired all the time. Boy, we need to get some X39 going here. You know, are you having pain, inflammation? Yeah, muscles and joints just get out of bed, and man, I'm sore and tired and don't feel like moving around, don't feel like exercising. And okay, we're doing some X39 here. Chronic infection, things that are kind of maybe even a mystery of why do I feel this way, even though my labs might be kind of off or seemingly okay. Maybe I'm not doing the right labs. I've not worked with Dr. Scott yet, but well, okay. X39. Now we start to feel better, and we can start to kind of see really what's beneath all this. So yeah, it's actually hard for me to find a patient that won't benefit because we're talking about undoing the process of aging and environmental damage and toxicity, and that's happening to everybody.
Yeah, 100%. That's cool. So a couple specific questions then, and again, because I haven't talked to you enough about this to know all the details and all the things that you're utilizing in practice. So let's talk about mental health real quick, because I know you had the one slide up of the brain imaging, which was really cool. But
Sure.
so specifically speak to, because I know I and a lot of people on tonight, and we're, it's just like anxiety and depression are just, I mean, like who hasn't experienced that to some
Right.
degree, some mild, some severe. So talk to us a little bit about that if you've seen results.
Yeah, really we have. And I think they're both direct and indirect. I think indirect would be because of the improved sleep, depth of sleep, length of sleep, and quality of the sleep cycle. So I think improving the sleep cycle has helped significantly. And this is essentially, I would say, independent of, well, it's X39 plus all of these other 5 things that I have everybody do. I mean that again, you know this, Dr. Scott, you don't necessarily just treat with one thing when you know that 10 things would be helpful, but I can tell you that without really making changes other than adding phototherapy patches, patients do sleep better. So I think their sleep allows their brain to, cleanse itself during the night, renew for the next day, make those healthy neurotransmitters that you're helping them with their gut. And now it's ready for, a new day. And then we see a decrease in that anxiety, depression. I think there's also direct effects when we talk about, unhealthy, effects on the brain, maybe from infection, like COVID, I'll say it, or from maybe the effects of alcohol or just bad food or early, insulin resistance. And we have some amyloid plaque building up, maybe even, and our memory's not so great. Well, you have damaged neurons that need stem cells now to renew them. So we can have direct effects on the neuronal and tissue health of the brain.
That's so cool. I'm excited to learn more about it. So, okay, so then next one. I'm just going to go one to the next here. I have a million questions, but I'll keep it to like 4 or 5. So you did talk about osteoporosis at one
Mm-hmm.
point in the last few minutes. So I had a conversation today with a patient of mine, and she just was in for like a preventative DEXA scan. Okay. And they came back and they like called her like that day, which is out of the ordinary, number one. And they said, you like it's severe, like severe osteoporosis. And she was so caught off guard because she exercises, does weight bearing, takes great supplements, really takes care of herself. So, and they ran every test you could possibly think of with blood work, blah, 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 blah. And they can't figure out why. They even sent her to a specialist, and this was all happening this summer. So, because of what you said about osteoporosis, I started thinking, and I actually mentioned this to her today. What is it about these that's going to help bones? Because
Sure.
the demographic that's here tonight, all of us need strong bones, but of
Mm-hmm.
course, osteoporosis is most commonly associated with, females and, let's say 40, 50 plus.
Yeah, it is. So it's so common. And again, it's something that can start a lot earlier in life and we just don't recognize it till
Right.
later. It doesn't mean we don't do anything. Of course we do. And of course we can do it. And that's the exciting thing. I mean, to build bone, you need bone building cells called osteoblasts. Think of the bee saying that we're going to build bone. Well, if you have 10, you'll build at a certain rate. If you have 1,000, you'll build at a much higher rate. So the more osteoblasts that you have, the more bone you'll build and the more quickly you'll build it. And of course, they're working with you to, make sure they're absorbing and getting adequate amounts of their calcium, their vitamin D, their boron, their other important minerals. And then they're taking what those building cells, those osteoblasts, to build that bone. Now, what a stem cell can do, if you can activate the stem cell, is it can sense we need more bone building cells. So I'll turn into an osteoblast. I'll turn into a bone building cell. So again, activating those stem cells then triggers the body to say, okay, now we have more, essentially more workers to build that bone, that structure. And your construction project of your bone becomes much more robust and effective.
Okay. Yeah, makes complete sense to me. B, osteoblast, bone builder. They didn't tell me that must be a med school thing. They didn't give us that little tip in chiropractic school. My goodness. So I
Oh
like
man,
that. D for
yeah, I had to survive. So
yeah, that's right. Me too. Believe me. Okay, so next question, musculoskeletal. So let's talk specifically joint cartilaginous tissues, like say a knee meniscus or the cartilage under the kneecap. I've talked to a couple
right,
people about this recently, so I'm asking specifically. But you mentioned shoulder, you mentioned low back, so just
yeah,
musculoskeletal stuff in general. But specifically, we know cartilage, collagen is so important. So what kind
yeah.
of results have you seen there?
Yeah, so I think again, couple of ways that those areas improve directly and indirectly. The indirect goes back to your healthy sleep and restoration that then reduces that baseline level of inflammation. So your body is spent doing, less putting out the fire and now more rebuilding and construction. So when you help them get their gut healthy, you're reducing their inflammation. Now their sleep is improved, the inflammation is down. Now we can focus efforts on not just literally or almost literally putting out the fire, but rebuilding that cartilaginous tissue. That's where the stem cells come back in is okay, once they're activated, they know that, okay, there's a damaged knee here. How can we rebuild it? Because again, that knee damage, that shoulder damage, that lower back arthritis, really, I mean, those joints don't, they need new cells, and they need the materials to um, replenish those cells, but they need those cells to be activated and turned into that particular kind of cartilage or that particular kind of bone or joint lining tissue. And you need to activate those stem cells, and now the joints become healthier.
Yeah, I'm excited for that. I mean, so just a little short testimonial would be when Dr. Dodge first he gave me some samples, and it wasn't the X39 because again, I'll say this too. There's a lot of different patches, which we probably don't have time to go into that tonight for different purposes. The X39 is kind of, I think, the gold standard if I'm not mistaken. For its widespread effects, but you gave me what's called Ice Wave, which the Ice Wave, to my knowledge, correct me if I'm wrong, is kind of like more of an acute use, like kind of like instead of taking ibuprofen, which is going to kill my stomach, let me put it. So I have a bad knee from a football injury, and it's never going to be the same. There's nothing I can really do about it besides just care for myself. And so, man, I'll tell you what, because I still work out hard and push my body, and then my knee was a little achy, and I put those things on, and I mean, literally, it was that same day. I was like, oh my goodness, yeah, like I could tell a difference, right? So I just wanted to, yeah, just my experience so far, and I'm excited. I just ordered the X39, so I'm excited to use those. So okay, I don't know if this is if this isn't relevant, let me know. But you talked a lot about peptides.
Yeah. Yep.
Somebody in this crowd is probably, because of just the widespread um, use of the word peptides. Peptides are all over the news. They're all over social media, but specifically GLP-1,
Mhm.
right? So have you used this in relation to, instead of doing like and I don't even know if you prescribe GLP-1, you can talk about that. You don't have to, but just with weight loss and some of those things that are kind of the buzz right now.
Sure. Yeah, and really all goes back to health, right? Like in a certain patient, weight loss might be an aspect of health that we want to focus on. In a certain patient, weight gain might be an aspect of health we need to focus on. So with the GLP-1, which yeah, they're peptides, and yeah, we do use them in our practice in our office, and highly complementary to X39 and vice versa. Meaning your X39 is activating specific peptide. The other, you mentioned the ice wave and the other different, I guess, wavelengths that the different patch offerings are targeted at do different things in the body. One actually makes glutathione or helps your body make glutathione. So, a very important antioxidant. So, in the case of, we are producing peptides and we all know, okay, they each have a certain, say, area of focus. And the GLP-1s focusing on satiety hormones, but also have another, lots of other fun effects, gut healing, brain health, hormone balance. So in the case of X39, you're right. It's typically our first go-to for patients because it has such widespread effect. Okay, of all the LifeWave technology, it's the one that would say does the most for the most number, say number of actions for the greatest number of people. But then as we continue a course of treatment for somebody, and their health journey progresses, we're selecting some of the more specific ones. So yes, can be used along with, or in a lot of cases, maybe instead of a GLP-1.
Yeah. Okay. Very cool. Thank you for that. And the most important question that I have of the night, and it's the last one I have, and then I'll open it to everybody else, is okay. So you had these slides of the guy, the balding guy. I was blessed with a great thick head of hair, honestly, too
Got
thick.
great hair. Yeah.
But oh, thanks. I appreciate that. But I'll tell you what, on a daily basis, my kids are like, Dad, you're getting a lot of gray in your beard. Is there any melanin benefit here?
Oh man. Well, I've been using mine now. Let's see. I'm about 6 months in, and I still got some white. So, like I said, that
Yeah.
picture we saw, he was 9 months in, and he didn't quite look like your hair. So, playing the long game here. This didn't happen
Uh,
overnight. It didn't happen in 8 or 9 months. So, I'm what I tell patients with X39 is you're steering a large and fun cruise ship the right direction, right? We're gonna have fun on the cruise, but we got to turn it this way, but we don't just flip it around overnight. So it's gradual. You'll notice you get some quick wins with it. I'll say within a few weeks, 4 weeks, 5 weeks, you're noticing quite a bit. But there's lots of things in the body that are just going to need a little bit more time. So
yeah.
yeah, I'm looking for a Dr. Keller-esque color
I'll tell
here.
you what, it's earned, man. I'll tell you, it's earned. You've earned every one of them, and it's looking great. So, all right, guys, ladies, questions. Anybody have anything for Dr. Dodge? Stephanie, go ahead.
All right, ready to rip? Okay, here we go. First, thank you for this because I have heard about the patchy
Uh-huh.
situation before, but I really don't know anything. So I'm appreciative to learn. I have a couple questions. I have three. My first one is regarding, so you talked about musculoskeletal, Dr. Scott, and so I have cysts in my knee, many.
Mhm.
And then, although I have them in other places in my body too, do you happen to know if this helps mitigate the
Hmm.
either building of the cyst or shrinking a cyst or?
Sure. No, great. No, thank you, Stephanie. I mean, and I think in the case, where you have something like that, a lot of times these things form in response to something, whether it's injury or inflammation or infection or some type of insult. And so then again, trying to normalize that situation and say, well, those are maybe the body's second best response to whatever's going on, just so you can carry on and survive and live life. That's what a lot of times happens in our bodies. Um, so anything that you can do that would promote cells that are actually healing rather than just kind of, you know, shut the door and pretend it's not there kind of a situation, then yeah, that's what you want to do. Yeah.
Okay, okay. Cool. I have a second question. I'm a swimmer, so are these patches staying on?
We've had great success with that. I personally, put them through the test, same thing in the water, working out, middle of the summer in the heat and humidity. The only time that, you might have an area like for a guy that wants to put it on a certain place, okay, you might have to shave some hair off, for example. Okay. Or we have some patients that might just use a little bit of an alcohol wipe to prep the skin and then put it on. But we've really had good success with that. I've had very few people have to, say, tape them on. I've had a couple of patients that had them on kind of an awkward place on their foot or ankle where there's some, bony prominence there, but even then they do well.
So, so if you're getting up at dark 30 and your workouts at dark 30, are you
Mhm.
putting the patch on before you go work out at dark 30, or is it after?
I almost always do. Yeah, I do. Because I
Before?
want that energy for the
Yeah.
workout. And I find that I don't need any real, drink coffee or pre-workout type, anything. I put the patch on and it's go time.
All right, last question. I happen to have a friend who has cirrhosis of the liver, and would this assist with that as well?
I would hope so. Again, there are, in my world, I think Dr. Scott's there's always something you can do, more of, do less of, test, treat, try. There's never a never until
Yeah.
there is. So, cirrhosis refers to scarring, the tissue. Well, could you reverse the scarring? I suppose in theory, yeah. Could you also grow that healthy liver tissue around the scarring such that the scarring almost becomes not relevant anymore because the rest of the liver that isn't scarred is highly functioning.
Yeah. Okay. Cool. Well, thank you.
Yeah, thank you.
And everybody can check out the chat area there too. Melissa put in thisisitinfo.com if you want to just learn more, watch testimonials. And I'm going to add in, you can visit this website. You guys could click on it or just write it down or whatever. Take a screenshot, lifewave.com/Dr. Scott FM. And again, the website just has a lot of info on it. You can look at the different patches, look at price points and all that kind of stuff. So, but a few minutes left. Does anybody else have a question?
Is there anything the patches can't mix with, or that people are taking or supplement, or anything that should not interact?
So yeah, great question. When they did the research, and that they'll say this in the product information materials, they did not study it in kids or in individuals that were pregnant or breastfeeding. Now, that said, there's a lot of anecdotal, meaning patient testimonials and kind of their experience of they've used them in people under 18 and in pregnancy and so forth with not only no harm but great benefit. So those are areas that we always caution with. And the other one too, and I'll just say it as a physician, they did not study it with patients with active cancer. So there's a lot of debate on that within the medical field and the professionals using these and the patients using them. I'll say that it's probably commonly used in that case, but again, the manufacturer's guidance is, well, we can't tell you to do that because we didn't study it in those patients. So those are some areas to just do a little bit more research on before you embark on that.
But there's no known, like, as far as supplementation, herbal, natural stuff, nothing like that, right?
No,
What about
in fact,
medications though? Any
sure.
contraindication medication wise?
No, I would say you'd want to just be, it always helps patients, people to be real as much as they can self-aware of, I'm starting something new, how do I feel? And they work with you, they know how to do that, how to map their progress and how their body's responding. But I would say things like stimulant medications, for example, patients might be on something for their mood or concentration that's more of a stimulant component to it. They might notice that they're amped up a bit more because of the energy produced by X39. And quite frankly, in my practice, a lot of times we will reduce dosages of medication as time goes on because we're able to.
Yeah, it's
But as
amazing.
far as a danger goes, that would be pretty unusual. Just anything that is kind of a mood altering medication, we just have to want to, be aware of that we might need to be either decreasing the length of time on the patch. We might only wear it for 6 hours instead of 8 or 12, or we might start to talk about with whoever's prescribing that medication a bit of a dose reduction.
Great, great, great. Wendy, I saw
And
your
also
hand.
just to share real quick, sorry, Scott.
No, go ahead.
There is though also expectation of you're not going to always necessarily feel amazing right away. Some people will, some people won't. There can be a period of time of a detox effect. And so when stem cells are getting activated and working in our system, they're starting to fix things. In that fixing, there can be a release of debris, or they're washing out of the system and getting toxins out of the system, which might cause not like debilitating effects, but maybe like, oh, flu-like symptoms, or oh, maybe there's a little bit more pain somewhere that's getting worked on. So just want people to be aware that sometimes in the process of it, and it could happen in the beginning, it can happen in the middle, later, and that's a stem cell process thing that we see with others, that we do other stem cell therapies at the office, and we've seen that there as well. So we've noticed that with the patches too, that sometimes there's either a period of latency where you don't feel like anything's happening, but yet there's a lot of stuff happening underneath, because all of a sudden then you'll see progress, or you'll see a detox where it feels like you're getting a little worse before you get better.
Perfect, perfect, perfect. Thanks for adding that, Melissa. Wendy, I saw your hand up.
Yeah, I mean, I think Brittany asked mainly where I was headed, which was like, it all sounds great, but there's usually a downside, or could be for certain people. That's usually what I'm looking for. I'm a natural born skeptic, so that was that was where I was going. And but my other question was, I saw like the general is 12 hours on, 12 hours off, but I understand that can change patient to patient. Is this like something you would wear like every day for a very long time? You're just going to keep going with it?
Well, yeah, it's a great question. I always, your skepticism is welcome, and I love the skeptics, because I mean, and I'm one too. And I love watching actually people's faces, especially like Dr. Scott's experience with the ice wave of, this shouldn't work, but why is it working? Melissa and I were at a conference this weekend, and it had another doctor that had a really bad migraine, was wearing sunglasses in the lecture. And I couldn't help but notice, I said, yeah, you must have a migraine. Yeah. I said, well, I've got something if you want to try it. She puts the patches on and takes her sunglasses off and says, I don't know why this is working, but it's working. I said, well,
Wow.
okay. So the to me, and it's always the proof's in the pudding, right? So you wear it, and it just realistic expectations. Yeah, it could take a long time to notice effects. And to your question of, well, then, okay, it took me 6 months before I felt good, and now I feel really good. Do I need to keep doing it? Well, my answer to that is, well, how long do you want to feel good? Because your body at the same time is up against time, right?
Mhm.
And again, everything and you've done all the healthy things. So to me, it's an ongoing investment in how good you want to feel and how far you want to take your health journey.
On
Thank
that
you.
note, I'm sure there's probably some, I don't know if there's any evidence out there or if you've done this, but like maybe cycling. If someone, and so maybe it comes down to budget. I'm not only a skeptic, but I'm also a realistic thinker. It's like, okay, cycling, like maybe 1 month on, 1 month off, or some other different type of cycle.
Mhm. Yeah, interestingly, and I've tried that myself too, or just even naturally, like, oh, I went away for a few days and forgot to bring some patches with me. I notice to the degree where it's really worth it to me to say that that's something I'm going to keep using. And it's difficult because sometimes you say, well, I don't feel any different, maybe, and say, well, I don't necessarily feel any different right away if I miss a day of vitamin D or a week of vitamin D. Well, right, the feeling may come later. The hormonal effects of vitamin D on your body, it might allow an infection to come in that wouldn't have otherwise.
Mm.
So, yeah, to your point, Dr. Scott, I think uh, patients sure can, and I think no harm in that. But I think after that, just that initial journey of back to mindfulness of your symptoms, what your doctors and other professionals you're working with are telling you. You measure that and you could say, okay, yeah, and then I stopped and I felt a certain way when I stopped and my labs did a certain thing. And I think really the important part that I'd coach patients to is just being self-aware of, what has really improved here, and how much further do I want to take that improvement, or how long do I want to maintain that, and then making the decision to cycle on or off based on that.
Any other final questions? I know we're past time, but this is a fascinating topic, and we have, Dr. Dodge on, so that's amazing. Anybody else have a final, maybe one or two more questions here? And if not, that is all cool. So, okay, if anybody thinks of anything, but here's my ask for the night for you guys is, again, I am always upfront and honest. I am still learning about all of this. But it is exciting. The research and some of the things that I have watched and read and listened to is just exciting stuff. So go to those two websites. This is it, info.com or the lifewave.com hashtag. Where'd that come from? / Dr. Scott FM. Share these websites with people, right? Like friends, family, coworkers, neighbors. Guys, people are hurting. We all know that. And then the last thing, share this with them too. So in the chat, you guys I think every one of you started with just a free consult with me. And so, gosh darn it, like people that that need help, just give them the information. Let them do with it what they will. Encourage them with the LifeWave, with setting up a free call with me for the functional med work, but also with Dr. Dodge and Melissa here at Aletheia. I said it in the beginning. I'll say it again, in Lincoln. You guys don't do virtual stuff yet, do you?
We do, yeah.
Oh,
several states actually. So yeah.
There we go. So just, I know if you're in Lincoln, you guys are awesome because you'll sit down and talk to people and just like you spend time with people, which is just amazing. So yeah, guys, just everybody check out Aletheia, check out LifeWave, and then tell people to set up some calls with us, right? We're here to help. This is you guys all know me well enough, but I can tell you on my screen, the Brady Bunch screen, he's that way, but I don't know where Dr. Dodge is on your screen, but he's right there to me. It's just like we do this because we're passionate about serving and helping people, right? That's really what it comes down to. So we appreciate all you guys for being here. And Melissa, thanks for running the slides. Awesome job. Dr. Jamie, thank you so much for spending time. I know, gosh, it's probably like, do you have a couple? Yeah, how many X39s can I put on my body at one time? If I've got like all the.
How much room do you have?
Yeah, right. So anyway, all joking aside, we appreciate you taking your time out of your day to come on and educate us all. Appreciate it. Everybody have a great night. If you have questions about this, if you have questions about LifeWave specifically, definitely I'll channel them through me, but more than likely I will pass you on to Dr. Dodge or Melissa because they know a lot more about it than I do. So anyway, just get a hold of us, okay? Everybody have a great night. Get some good rest. Get some good sleep. Oh, and Melissa just put in the chat, if you have anyone looking for more info, she's happy to get on the phone with you too. So like I said, let me know and I can hook you up with her. So, all right. Good night, everybody. Bye-bye.